The Bronx. The Bronx beats with the vibrant pulse of hip-hop, where every street corner tells a tale of resilience and boundless creativity. Among the colorful murals and lively community hubs, however, a darker reality persists. Homelessness casts a long shadow over the borough. This iconic New York neighborhood, renowned for its cultural richness and close-knit communities, is grappling with a crisis that threatens to tear apart its strong social fabric. As skyscrapers rise beside improvised shelters, the quest for stability becomes increasingly stark. In this exploration, we journey into the core of the Bronx to understand the current landscape of homelessness, unravel the complex factors fueling this struggle, and examine the widespread substance abuse affecting those without a home. Through these stories, we seek to illuminate the challenges and discover avenues for restoring hope and dignity to countless lives. Current state of homelessness in the Bronx. The Bronx, renowned for its rich tapestry of cultures and traditions, has been experiencing a notable increase in homelessness in recent years. By 2023, data reveals a significant rise in the number of people lacking stable housing. This growth presents a complex challenge for both the community and local authorities. Over the last 5 years, the homeless population in the Bronx has grown by approximately 15 to 20%. This increase is more than just a numerical trend. It underscores deeper socioeconomic changes and systemic problems. The growing numbers put immense pressure on existing resources, emphasizing the critical need for comprehensive strategies. The homeless population in the Bronx is varied, including individuals from different age groups and backgrounds. It ranges from young adults trying to establish themselves to elderly people who have lost their residences, covering a wide spectrum. Additionally, there are families with children, single individuals, and those who have become homeless due to unexpected events such as sudden unemployment or medical crises. Certain regions within the Bronx have emerged as focal points for homelessness. Areas like Pelham Bay Park, Van Cortlandt Park, and neighborhoods near major bus terminals are frequent gathering locations. These spots offer some degree of shelter and easy access to public transportation, making them attractive to those without permanent homes. Moreover, community centers and local shelters in these key areas often operate beyond their capacity, struggling to accommodate the increasing need for services and support. Addressing this issue is essential to restoring stability and dignity to many lives within the borough. Root causes of homelessness in the Bronx. Grasping the underlying reasons for homelessness is essential for effectively addressing and alleviating the problem. The causes of homelessness in the Bronx are complex and multifaceted, encompassing economic, social, health, and policy-related factors. On the economic front, a primary driver is the soaring cost of housing. Rent in the Bronx has surged dramatically, outstripping wage growth and making it increasingly challenging for low-income residents to obtain and sustain stable housing. A 2023 report by the Bronx Housing Authority highlights that average rents in the borough have risen by 25% over the past 5 years, whereas median household incomes have only increased by 10%. This significant gap places immense financial pressure on residents, pushing many toward homelessness. Moreover, a considerable number of individuals experiencing homelessness lack steady employment or earn wages that are insufficient to cover basic living costs. The scarcity of job opportunities and the prevalence of low-paying positions further intensify financial instability, driving more people to the edge of homelessness. The Bronx boasts one of the highest unemployment rates in New York City, with 8% of its population unemployed compared to the citywide average of 6%. Additionally, many of the available jobs do not offer livable wages or essential benefits, making it arduous for individuals to achieve financial stability and secure housing. Social dynamics significantly contribute to the rise in homelessness. Conflicts within families, divorces, and incidents of domestic violence are primary drivers of individuals becoming homeless. Those escaping abusive or unstable home situations often find themselves without a secure place to reside. Over the past 3 years, the Bronx has experienced a 15% surge in reported domestic violence cases, which directly aligns with an increase in homelessness among those impacted. Additionally, the borough's social support infrastructure frequently falls short in addressing the needs of the homeless population. Limited availability of crucial services, including mental health care and addiction treatment, leaves many without the support required to achieve stability. Currently, only 40% of homeless individuals in the Bronx can access mental health services, underscoring a major deficiency in available assistance. Policy-related issues further exacerbate the problem. Zoning regulations and building codes restrict the supply of affordable housing, while inadequate investment in public housing projects means that demand significantly outpaces supply. In 2023, the Bronx was allocated only 60% of the federal funds designated for affordable housing, resulting in prolonged waiting lists and overcrowded shelters. Moreover, systemic challenges such as discrimination and limited access to education and healthcare disproportionately impact marginalized communities, heightening their risk of homelessness. Tackling these fundamental issues necessitates comprehensive policy changes, increased funding for social services, and targeted economic initiatives aimed at fostering a more equitable and supportive environment for all residents. Health and psychological factors. Health and psychological challenges add another layer of complexity to the issue. A large segment of the homeless population battles mental health conditions. In the absence of adequate treatment and support, these individuals struggle to secure and maintain jobs and housing. Substance abuse plays a dual role, both precipitating and resulting from homelessness. Many resort to drugs and alcohol as a way to cope with the difficulties of living on the streets, deepening their entanglement in the cycle of homelessness. Moreover, policy and regulatory issues exacerbate the situation. The lack of affordable housing is a significant problem. With limited investment in public housing initiatives, the need greatly surpasses the availability, leaving numerous people without suitable housing options. Additionally, certain local regulations constrain the movements and activities of homeless individuals, hindering their access to essential services and worsening their predicament. Substance abuse among the homeless in the Bronx. Substance abuse continues to be a significant challenge within the Bronx's homeless population, exacerbating the difficulties of homelessness and obstructing paths to recovery and stability. The consumption of drugs such as heroin, cocaine, methamphetamine, and alcohol is disturbingly prevalent among those without homes. A 2023 report from the Bronx Health Department revealed that around 45% of homeless individuals admitted to using at least one illicit substance in the past year. Alcohol topped the list at 30%, followed by methamphetamine at 25%, heroin at 20%, and cocaine at 15%. Many homeless people turn to these substances as a way to escape the harshness of life on the streets, seeking temporary relief from the constant stress and pain they endure. Substance abuse often serves as a coping mechanism for dealing with significant stress, trauma, and mental health challenges that are part of their daily existence. While these substances may offer a short-term escape, they lead to long-lasting negative consequences. The inherently unstable and unpredictable conditions of homelessness, such as the lack of secure shelter, exposure to the elements, and ongoing uncertainty, create an environment that makes addiction more likely to develop and persist. The ramifications of substance abuse extend deeply into various aspects of life. Health-wise, individuals are more vulnerable to infectious diseases such as HIV/AIDS and hepatitis, experience respiratory complications, and suffer from severe mental health conditions. For example, the rate of HIV among the homeless population in the Bronx is estimated at 12%, which is markedly higher than the national average of 0.4%. Addiction often leads to fractured relationships, greater involvement in criminal activities, and a reduced capacity to obtain and retain jobs, thereby perpetuating the cycle of homelessness. Economically, substance abuse imposes significant burdens. Medical expenses escalate due to the necessity for treatments, and social services become overwhelmed as they strive to support those struggling with addiction. In 2023 alone, the Bronx dedicated over $50 million in additional funding to manage the growing costs linked to substance abuse within its homeless community. Moreover, substance abuse intensifies pre-existing mental health challenges, creating a relentless cycle that is hard to break without comprehensive support. Initiatives aimed at mitigating substance abuse have demonstrated effectiveness. For instance, the Bronx Recovery Initiative achieved a 40% success rate in helping individuals attain sobriety through their holistic treatment programs. Nevertheless, the need for services greatly surpasses what is currently available, underscoring the critical necessity for expanded resources and support systems to effectively address substance abuse among the homeless population in the Bronx. Addressing homelessness and substance abuse pathways to solutions. Addressing homelessness and substance abuse in the Bronx demands a comprehensive, multidimensional strategy that confronts the underlying causes while delivering immediate assistance to those in need. A fundamental approach is the expansion of affordable housing. Prioritizing the development and upkeep of low-cost housing units is crucial. Enhancing the supply of affordable residences can provide swift relief to individuals struggling to secure stable living conditions. Moreover, establishing rental assistance programs that offer financial support for housing can help people retain their homes and prevent homelessness. This assistance is essential for those experiencing temporary financial hardships. For example, recent research shows that rental assistance initiatives have effectively reduced homelessness by up to 25% in similar urban areas, underscoring their impact. Economic support is another vital aspect. Developing job training programs tailored to the specific needs of the homeless population can enhance their employability. Creating employment opportunities that offer fair wages ensures that individuals can support themselves and their families. Adjusting the minimum wage to align with the cost of living can help low-income workers afford basic necessities, including housing, thereby decreasing the risk of homelessness. In the Bronx, where the minimum wage is currently $15 per hour, adjusting it to better reflect living expenses could potentially lower the homelessness rate by an additional 10%. By implementing these measures, the Bronx can move closer to mitigating homelessness and substance abuse, fostering a more stable and supportive community for all its residents. Healthcare and mental health services are crucial in tackling these challenges. Providing homeless individuals with access to comprehensive healthcare, including mental health support, is imperative. Mobile clinics and community health centers can help bridge the accessibility gap. Increasing funding and expanding substance abuse treatment and rehabilitation programs are vital to support those striving to overcome addiction. Recent statistics reveal that around 60% of the homeless population in the Bronx contends with some form of substance abuse, highlighting the critical need for effective treatment initiatives. These programs should integrate medical care, counseling, and community support to address both the physical and mental facets of addiction comprehensively. Additionally, incorporating case management services can ensure that each person receives tailored assistance based on their specific needs. By coordinating housing, employment, and healthcare resources, case managers can guide individuals through the complex system and help them access the necessary tools for achieving lasting stability. Collaborative efforts among government bodies, non-profit organizations, and community groups are essential to establish a cohesive support network. For instance, partnerships with local businesses can aid in job placement, while collaborations with mental health professionals can improve the quality of care available to those in need. By working together, these entities can create a robust framework that supports homeless individuals in rebuilding their lives with dignity and hope. In addition to these strategies, it is crucial to implement preventive measures that address the underlying causes of homelessness and substance abuse. Early intervention programs targeting at-risk youth can significantly reduce the likelihood of individuals becoming homeless or developing substance abuse issues later in life. Educational initiatives that promote financial literacy, mental health awareness, and healthy coping mechanisms can empower individuals to make informed decisions and seek help before crises escalate. By adopting a holistic approach that combines housing, economic support, healthcare, and preventive measures, the Bronx can make significant strides in combating homelessness and substance abuse. These comprehensive solutions not only address the immediate needs of the homeless population, but also work towards creating a sustainable and supportive environment that fosters recovery and resilience. Social support systems. Equally crucial are social support systems that address the root causes of homelessness and provide a safety net for those in need. Offering counseling and mediation services can help resolve family conflicts and support individuals in preserving stable family relationships. Programs focusing on psychological well-being and stress management can empower homeless individuals to navigate their struggles without turning to substance abuse. Revising restrictive regulations that limit the freedoms of homeless individuals can foster a more inclusive and supportive environment. Policies should prioritize providing help and resources over penalizing those in vulnerable situations. Strengthening partnerships among government agencies, non-profits, and community groups can lead to a more unified and effective response to homelessness and substance abuse. Public education and awareness also play a vital role in tackling these challenges. Increasing awareness about homelessness and addiction can help combat stigma and encourage community support. Educational initiatives that emphasize the importance of compassion and proactive intervention can inspire collective action. Furthermore, implementing programs focused on teaching coping skills and preventing substance abuse can equip at-risk individuals with tools to avoid homelessness and addiction. This raises an important question: what role can individuals take in addressing homelessness and substance abuse in the Bronx? Community engagement through volunteering, donations, and advocacy can create significant change. Similarly, how can visitors contribute to positive efforts in areas impacted by homelessness? Supporting local organizations and spreading awareness are meaningful actions. If this discussion resonated with you, consider liking, commenting, and subscribing to our Travel Documentary channel. Your engagement enables us to continue highlighting critical social issues and sharing stories that matter. Share your thoughts below. What strategies do you believe can better support the homeless community in the Bronx? Comprehensive solutions, a multidimensional approach. Addressing homelessness and substance abuse in the Bronx calls for both immediate and long-term strategies that integrate various aspects of society and governance. Implementing housing solutions that pair shelter with comprehensive support services can lead to significantly better outcomes. These programs offer not only a stable living environment, but also essential resources such as healthcare, job training, and counseling, promoting recovery and long-term stability. For example, Housing First programs focus on providing permanent housing without preconditions, enabling individuals to tackle other challenges more effectively. Engaging local communities in these efforts is essential to ensure meaningful and effective interventions. Community centers, grassroots organizations, and local NGOs are invaluable in offering tailored resources to meet the specific needs of the Bronx. These groups often provide critical first-line support, including meal services and legal aid. Moreover, fostering collaboration between public and private sectors can optimize resource distribution and encourage innovative solutions. Public-private partnerships can result in more affordable housing and the implementation of well-rounded support systems. Harnessing technology can simplify access to essential services and enhance the efficiency of support systems. Tools such as mobile apps that link homeless individuals to resources, online platforms offering job training, and data-driven analytics to track trends and needs demonstrate how innovation can contribute to solving these challenges. For instance, applications that provide real-time information on available shelters or job opportunities can offer immediate support to those in need. Similarly, public awareness campaigns aimed at reducing the stigma surrounding homelessness and substance abuse can inspire greater community involvement. By nurturing a collective sense of responsibility, communities can become more supportive and resilient in addressing these issues. Pushing for policy reforms at local and state levels can pave the way for more effective solutions to homelessness and substance abuse. Policies that emphasize the development of affordable housing, allocate greater funding for mental health services, and uphold fair labor practices are critical components of a long-term strategy. Preventive measures, such as early intervention programs targeting at-risk youth, can play a pivotal role in reducing the chances of individuals falling into homelessness or substance dependency. Ultimately, while policies and statistics are essential, it's crucial to recognize the personal stories behind homelessness and substance abuse in the Bronx, as these narratives bring humanity to the forefront of the crisis. Each individual has a unique journey, marked by struggles, resilience, and the pursuit of dignity. By sharing personal stories, we can foster empathy and understanding. Hearing from those who have experienced homelessness and substance abuse firsthand provides invaluable insights into the challenges they face and the support they need. Highlighting success stories of individuals who have overcome homelessness and addiction can inspire hope and demonstrate the effectiveness of comprehensive support systems. These narratives underscore the potential for recovery and the importance of continued efforts to support vulnerable populations. Homelessness in Queens. Alongside the Bronx, Queens stands out as another New York City borough grappling with significant homelessness challenges, each shaped by its distinct dynamics. Known for its cultural diversity and expansive neighborhoods, Queens has experienced a steady rise in its homeless population over recent years. By 2023, it was estimated that approximately 8,000 individuals in Queens were without stable housing, reflecting a 12% increase since 2018. This growth is driven by a mix of economic pressures, social hurdles, and systemic issues that hinder vulnerable groups from accessing secure housing. A major driver of homelessness in Queens is the soaring cost of living, particularly housing. Although generally less expensive than Manhattan, Queens has seen rental prices climb rapidly in areas like Astoria, Long Island City, and Flushing. Over the past 5 years, median rents in these neighborhoods have risen by nearly 20%, far exceeding wage growth and creating financial hardship for many low-income residents. This economic squeeze often leaves individuals and families forced to prioritize between rent and other basic necessities. When they cannot meet both, displacement and homelessness become a harsh reality, further intensifying the crisis in this diverse and vibrant borough. employment instability is a significant factor contributing to the homelessness crisis in Queens. Despite the borough's thriving job market in areas like healthcare, education, and technology, many residents rely on low-paying jobs that lack adequate benefits and job security. The rise of the gig economy, with its emphasis on freelance and contract work, provides flexibility but often falls short in offering the stability and protections necessary for long-term financial resilience. This precarious nature of employment makes it difficult for individuals to build savings for housing or recover from unexpected financial emergencies, leaving them at greater risk of homelessness. Social challenges, including family conflicts, domestic violence, and insufficient social support, further intensify the homelessness issue in Queens. Survivors of domestic violence are especially vulnerable, often forced to leave abusive situations without access to safe and stable housing. The shortage of shelters and specialized support services for their unique needs frequently leaves them with limited resources to rebuild their lives. Additionally, mental health challenges and substance abuse are widespread within the homeless population, serving both as causes and consequences of homelessness. The lack of accessible mental health care and addiction treatment makes it harder to provide holistic support to those in need. The effects of homelessness in Queens extend beyond those directly impacted. Communities face increased pressure on public resources, such as emergency shelters, healthcare systems, and social service programs. Neighborhoods with higher numbers of homeless individuals often see rises in petty crimes and disturbances, creating a sense of unease among local residents. Furthermore, the stigma surrounding homelessness fosters social isolation and discrimination, making it even more challenging for individuals to seek assistance and reintegrate into society. Efforts to combat homelessness in Queens encompass a range of strategies relying on collaboration among government agencies, nonprofits, and local community groups. Key initiatives include expanding affordable housing developments, boosting funding for mental health and substance abuse programs, and offering job training and employment placement services to address the root causes of homelessness. For instance, the Queens Housing Development Corporation has introduced several affordable housing units in underserved neighborhoods, creating more opportunities for low-income individuals and families. Meanwhile, organizations such as the Coalition for the Homeless and Project Renewal provide holistic support, including emergency shelters, case management, and long-term assistance to help people regain stability and rebuild their lives. Policy changes are equally vital in reducing homelessness in Queens. Advocating for stronger rent control policies, raising the minimum wage, and improving access to affordable health care are crucial steps toward a more balanced housing market. Additionally, tackling systemic inequities like racial and economic disparities can ensure marginalized groups receive the resources they need to prevent homelessness and recover from its impacts. Community engagement and public awareness play a vital role in combating homelessness in Queens. By fostering a sense of solidarity and encouraging residents to support local initiatives, communities can create a more inclusive and supportive environment for everyone. Volunteer programs, donation drives, and advocacy campaigns help bridge the gap between those experiencing homelessness and the resources available to assist them. In conclusion, while Queens may not have the same visibility as the Bronx in discussions about homelessness, it faces its own significant challenges that require urgent attention and comprehensive solutions. By addressing the economic, social, and systemic factors contributing to homelessness, and by fostering collaboration and community support, Queens can make meaningful strides toward reducing its homeless population and enhancing the quality of life for all its residents. Future Outlook: Striving for a Better Tomorrow. As we reach the end of this Travel documentary, It's a moment to reflect on the profound journey through the Bronx's fight against homelessness and substance abuse. What insights have we gained, and how can these lessons guide us toward impactful change? Delving into these intertwined challenges has shown us the critical need for empathy, perseverance, and collective responsibility. It underscores the value of comprehensive support systems and the irreplaceable role of communities in shaping a brighter future. Armed with this understanding, viewers are encouraged to take tangible steps to uplift the Bronx's homeless community. Whether it's through volunteering time, making donations, or advocating for meaningful policy reforms, every action contributes to creating a more compassionate and inclusive society. The dual crises of homelessness and substance abuse in the Bronx are urgent issues that demand awareness and action. By examining their current state, unraveling their causes, and seeking practical solutions, we have the opportunity to foster real and lasting change. Through this documentary, our goal has been more than just capturing the vibrant culture of places like the Bronx. We strive to shine a light on their struggles, urging viewers to become active agents of positive transformation. Thank you for embarking on this journey with us. Don't forget to like, comment, and subscribe to our channel for more compelling stories that matter. Together, we hold the power to create a better tomorrow.